I would be happy to do that. We're so excited. My name is Deborah Callahan, and we're very happy that all of you could join us here tonight. Our Knowledge's Power Hour is a forum for individuals seeking natural approaches for health issues, and as well as optimizing their general health and their well-being. And the discussions are centered on holistic alternatives to a variety of health concerns, sharing knowledge as we grow together, and using our talents and our gifts to make a difference in the wellness of the world. We feel that together we're creating a movement that is impacting many lives. Yeah. And with that, it is my great pleasure and honor to introduce you to our very special guest tonight, Dr. Charlie Rouse. And so I'm going to give you a little bit of background on Dr. Charlie. I'm going to read it because it's a lot. He's a doctor of naturopathic medicine. He's the founder of the Modexis Product Review Council. He is a registered pharmacist and a pharmacologist. And Dr. Charlie is the owner and operator of the Medicine Man Corner in Albany, Georgia. Dr. Rouse holds a weekly podcast helping people restore and optimize their health. And he has been a formulator of natural supplements for over 30 years. Dr. Charlie is an author and he's an international speaker, and he has a lifelong commitment to do no harm. And on top of all of this, he finds time to be the senior pastor of Liberty Baptist Church. So without further ado, I would like to introduce you to Dr. Charlie Rouse. Go ahead, Dr. Charlie.
Hi, Dr. Charlie.
All of y'all. Hey, all of y'all. Good to be with you.
Very good. Well, are you ready for us to ask you some questions and share your knowledge with us tonight?
And we're going to unload. Modexis is full of answers, so let's go.
That's right. Okay. All right. The first one we're going to ask tonight is, can you elaborate on longevity's effect on our gut health and why the health of our gut is so important?
Let's talk about it. Now, remember the name Lonacera Longevity. It was our first branded product, and it's very, very important to the whole issue to help you to live better, stronger, longer. And most people don't realize it, but health actually begins in the digestive tract. It sure does. Hippocrates, long time ago, said, all health begins in the gut. Now, you know, I don't know how he knew that, but here we are in modern day 2020, and now we know that. I've heard the old saying, you are eat. Well, put that into perspective of who Modexis is. And when you take the highest quality nutritional supplements, the best of nutrition, then you're going to find that, hey, that is what is critical to good health. And the truth is that longevity, Lonacera Longevity, was formulated to give you the best of the best. But I want you to consider this tonight. And if you're taking notes, this is something you want to write down. 70% of all of your immune system is found in the gut. How about that? And you know, there's a lot of things floating in the blood. The thymus gland is effective, the tonsils, the spleen, but 70% of all the immune system is found in the gut. And then think about this, 90% of all the brain chemicals, the neurotransmitters that the brain uses, 90% are formulated in the gut. So it becomes critical when people are going to be healthy that the gut has to be a primary focus. So Lonacera Longevity, when I was formulating and putting it all together, I recognized that. And I knew that we needed the ultimate in glutathione. We needed the power, the most utilized molecule in the gut is glutathione. And it needed to be in there in a position to where it can work it all together. And because the digestive tract, I mean, it's the largest the most complex of all the endocrine system. Now, the endocrine system is very complex because the hypothalamus, the pituitary, the adrenal gland, all of that is conducting your energy, your sleep patterns, etc. All of that is related to the gut. And so the most complex form of the human body in the adrenal system is in the gut. And we have 10 times more microbes living in our digestive system, in our digestive tract, than we do cells in our whole body. They're now estimating that in our gut flora, over 100 million, I said million, I should have said trillion, 1 trillion microbial cells down there, and well over 1,000 different microbes that are down there. So when you go buy a probiotic bottle with 100 billion, with 10 different formulas in it, far short. There's no like a probiotic and make the gut healthy. But what we found is if you use glutathione, it will symbiotically make all of the microbes, the 1,000 microbes that are responsible for the 100 trillion cells, to be saturated. And then the good will far, far, far outweigh the bad. People ask me all the time, Dr. Charlie, what kind of diet do you recommend? I say, well, when it comes to gut health, which obviously is important, just try the Mediterranean diet. Mediterranean is everything that's in creation, and it's very wholesome and healthy. And when you look at your bottle of Lonacera Longevity, when you flip it over, there's one ingredient in there called Centramin. Centramin. And that is a plant-based trace mineral. It's got 90 different trace minerals. We buy the product, trademark product from Broken Arrow, Oklahoma, and they're able to gather the organic fossilized nutrition out of the soil, and from that we get the perfect alkalinity. When you swallow 2 Lonacera Longevity capsules, we balance your alkalinity, your pH, the power of hydrogen. We won't let you go acidic because that's cancer, that's inflammation. And we don't want you to go too alkaline because that makes you too slippery and too stick. And so it is in there. So what are we dealing with? The question was, how does Lonacera Longevity affect the gut health? Well, most of the digestion and the absorption that comes into your human system is going to be part of your immune system. And Lonacera Longevity would be perfect for those who have the leaky gut syndrome, people who have poor vitamin absorption. Like some people have problems with methylation and they can't absorb vitamin B6 or folic acid. So we correct all of those problems. People with irritable bowel syndrome, people with autoimmune conditions. Lonacera Longevity is the perfect answer. People who have experienced colon, breast difficulties, all of the skin issues, eczema, psoriasis, cystic acne, all of that is dependent on a proper immune system, and we're feasting and building it through the gut. We're making it happen. People with chronic fatigue see a major improvement because the power of the immune system from the gut is what liberates. And it all happens. If you look at the back panel of the product, we have in there the Silifos, which is for the liver and the gallbladder and the pancreatic secretions. That one product can help people with constipation, can help their gut flora to become more normal. And if somebody grabbed their side on the right side, pain on the right side under the rib cage, that's usually where the syndrome of the pancreas or the gallbladder or the liver creates. And this nutrition is designed to make all of that get better very quickly. Lonicera longevity helps people with flatulence. It helps people with dry, flaky skin, dry, brittle hair, people who have chronic indigestion, they burp a lot, or they reflux a lot, or they have a hiatal hernia. That one nutrition is designed to work on the whole alimentary canal, not only in the esophagus and to the stomach, down into the small intestine, on into the colon. Polyps, when people go have a GI tract scope, the polyp prevention is in the Lonicera longevity. People who have allergies, whether it's in the nose, the eye, the throat, the lungs, Lonicera longevity is the perfect nutrition. And when I put it together, I knew that what we needed more than anything else was to be able to detoxify from this old toxic world. So welcome to Lonicera longevity. Most people can do super good with 2 pills, 2 capsules first thing in the morning. Your lowest glutathione level in the human body is first thing in the morning. So load up. And then if you're a go-getter, if you're a busy, if you got a lot of other things on your platter, then it's okay to take that second dose later in the day. So I would definitely say longevity is definitely for gut health.
Good, good. Well, thank you for all that wonderful information. Fantastic. Okay, our second question is, knowing that longevity can also help regulate our thyroid levels, if we are on medication, for example, Synthroid, how would we know if we could possibly be on a lower dose, and how do we test for it while we're on medication?
And I do get that question umpteen times. You're not going to believe how many people are on Synthroid, which is levothyroxine. And by the way, that prescription drug is a bioidentical synthetic version of the actual thyroid. So Synthroid's a real good prescription drug. And it comes in a plethora of sizes because everybody needs to be titrated or sufficiently fixed. And it can be as low as 0.25 or way over here to 1.5. You know, there's a lot of different pills. But Lonicera longevity was created with thyroid, Hashimoto, and other thyroid conditions in mind. And anytime we tune up the metabolism of your thyroid, then we're going to give you more usable energy. That's a good thing. Usable energy and using the body's energy more efficiently. And anytime people that are on Synthroid or other thyroid medications, anytime we can help them spend less energy to achieve the same level of function, then that's a good thing. In medicine, we call that energy cost of living. So anybody who has a thyroid condition, then we need to bring in Lonicera longevity to conserve their energy and to allow their energy to work better for them. And when that happens, they're going to feel better. They're going to have more pep. It's easier to control the weight. They're going to sleep. They're going to sleep more soundly because the thyroid is the major gland of all the metabolism of the human body. And it definitely talks to the pituitary, and the hypothalamus, and to its sister gland, the adrenal. And if you get that HPA axis out of whack, it's like, whoa, what are we going to do? Now, when you go to the doctor, they say, well, let me measure your T3 or your T4. And you know what that is? All we're doing is measuring iodine. The body, the organ, the gland, the thyroid is where all the thyroid primarily is absorbed and assimilated. And so we go in there and we measure T3, 3 iodines, T4. Now, T4 is just the storage unit because T3 is the usable. And when we find out what your T3 level is, then we look at your thyroid stimulating hormone from the brain and we put it all together. Now, in Lonacera longevity is Centramin, and in Centramin is the perfect iodine. So now we can build T3. Now we can build T4. And whenever the thyroid becomes deficient in T3, you're going to have thicker fingernails. You're going to have drier skin. You're going to be more sensitive to the cold. Women who have thyroid issues are going to have more excessive menstrual bleeding or more PMS. They're going to be not only tired, but chronically fatigued. Their libido will be down. They'll have more trouble waking up in the morning than most people will. And sometimes they'll complain of more depression than usual. And if they eat sugar, a little excess of sugar, it usually in those thyroid people cause mood swings, and they'll be more prone to irritability. If you look in the mirror, their eyebrows start thinning on the outer edge, and then they come around. Now the question was, how do we know that the Lonacera longevity is working conjunctively with our Synthroid? And it all has to be done with a basal thermometer. So get you a basal thermometer from the drugstore, and the first thing in the morning before you get up or stir about or do anything while still lying in the bed, take an axial under the armpit temperature reading. And if on a basal thermometer, a good basal thermometer, it's very hypersensitive, if the body temperature is 97.2 or lower, that indicates that we need more T3. We need more nutrition. We need more power to work the metabolism. Or the prescription drug is overcompensating and too strong. Doctor may need to back off from 1.0 to 0.88 or something like that. Mm-hmm. And because we're dealing with a bioidentical thyroid in the Synthroid, it's easy to adjust it. Mm-hmm. But I've had umpteen patients totally be able to eliminate Synthroid because it fixes their thyroid. See, it's not like putting a Band-Aid on a problem. It's like going in there and putting more iodine in the gland. And if they've got a thyroid gland that hasn't been surgically or radiation removed, mm-hmm. then they're going to probably be able to fix their problem. Go to the root cause. Good question.
Good. Thank you, Dr. Charlie. That's awesome. Awesome. Okay. Our third one is, what are your thoughts on fibromyalgia and taking a holistic approach to this debilitating syndrome? Would the Lonacera products be a benefit? And if so, why?
You know, that is very, very, very common. Fibromyalgia. When a medical doctor treats a patient for fibromyalgia, they not only have shoulder pain, but they generally will have in the ligament, tendon, fiber, muscle, in probably as much as 10 to 18 different zones of the body. So it's a misery. They don't sleep well. They're chronically fatigued. They are physically inactive because they're just pooped all the time and hurt all the time. And everybody needs a strong, sturdy, muscular, skeletal system. And to build your bones, your fiber, your ligaments, your tendons, your sinew, all of that requires super nutrition. And Lonacera longevity was designed for people with the autoimmune effects of fibromyalgia. A lot of fibromyalgia patients come out of a viral infection like Epstein-Barr viruses, creating all of the chaos and the confusion. But two things are important with Lonicera longevity. It's by far the world's best antioxidant, which cleans out the bad stuff. But Lonicera longevity, primary function is not only antioxidant, it's anti-inflammatory. Mm-hmm. Now you put an anti-inflammatory effect with an antioxidant effect into a fibromyalgia patient, and the first thing they start looking at is, wow, my joints, my muscles, my back, my shoulder, I feel better. I feel more flexible. And because fibromyalgia is such a vicious cycle, what we do is put longevity into their cycle, and it stops the inflammatory. It stops the oxidation. It stops them from rusting out. And anybody that we can give more stamina and flexibility to, then we've won a major, major battle. And because chronic exhaustion is a major factor, and we've learned in science that 40% of all the energy of the human body is used by the brain. So we came along with a product called Lift, Lonicera Lift. And with that Lift, when I formulated it, I made it to be a brain nutrition. Because if I can feed the brain the 40% it's looking for, then it'll let the rest of the body have what it needs. And when we did that, we have conquered a lot of chronic exhaustion and physical discomfort. And when they take the two together, the Lonicera Lift and the Lonicera Longevity, they stop feeling incapacitated. They start feeling more vibrant. The inflammation level goes down, and the immune system, which was the creative problem, gets modulated. It's not overreactive. And we don't ever want it to go underreactive, because then all the viruses and the bacteria will attack us. So it's good. Good muscle function, good energy production. And if you look on the bottle of that Lift, it has a little 3-letter herb in there. It's called ATP, adenosine triphosphate. And in the mitochondria, that's the factory of the human body that produces all the energy. Mm-hmm. It produces ATP. So we give you just enough ATP to be a catalyst, to be like a match to light the fire. And if we can spark your fire, we can get your red blood cells flowing. And when those red blood cells circulate, then we go into microvascular circulation. And now people with fibromyalgia, I've got thousands of patients that are in total remission on fibromyalgia.
Fantastic. Wow. Wonderful. Okay, this is fantastic. I love this. A good friend has asked, I take the Longevity and Lift products, but I also take an extra D3, B12, a probiotic, adrenal, and a multivitamin. Is it necessary for me to take the extra supplements?
No, not at all. Lonicera Longevity was designed to be the ultimate. Somebody had to choose a nutrition of choice. It's the number one in my daily routine. Me personally, it's rare that I take a multivitamin. Sometimes some people will offer me one. I may take it then. I rarely take a probiotic, just like I mentioned earlier. The gut health is the most important, but when we're dealing with 1,000 different microbes, what I want to do is feed my good microbes and let them be healthy. And that's how you do that with glutathione. D3 is in the product at 2,500 units per dose. So if I take 2 by 2, I've taken 5,000 units. Mm-hmm. That would be sufficient for anybody weighing 200 pounds. Okay. So somebody 100 pounds would only need 2,500 per day. we're talking about maximum therapeutic dosing,
Mhm.
and D3 does mechanistically work on the immune system and the blood pressure and a lot of different areas. So I'm a huge fan of D3, not D2,
Mhm.
D3,
Mhm.
the cholecalciferol, and it's in our product on purpose because most everybody that I look at their blood profiles, almost everybody is D3 deficient.
Mhm.
And with the sunshine in California, beautiful sunshine, we always clothe up so we don't get all the sunshine that we could.
Yeah, very good. Good. Okay, so another question is, if a client is limited financially, and is longevity the one product they should take, or does it depend if they have a specific problem, as in anxiety, cardiovascular, or diabetes?
All of those are definitely concerns of Dr. Rouse.
Mhm.
And when I formulated, I looked at it, I said, what makes people anxious? And it's their adrenal system.
Mhm.
Cortisol gets out of whack, hypothalamus and pituitary start miscommunicating. Definitely the insulin resistance has a lot to do with the sugar flow
Mhm.
and blood flow and all that. And so if you had to choose one vitamin out of all, if you came to my medicine man and whoop, we were busy the last few days. I guess people are just thinking about staying healthy. And in our store, we may have, say, a couple thousand, maybe 2,000 special condition specific nutritional products. And if I had to just rake them all over to the side and put that Lonicera longevity, I could probably focus in and help 90% of the people that come in. So for most of it, it's a singular nutrition. Like
Right.
we said, the brain is the energy cycle, and some people are hearing about tranquility. Hey, everybody's anxious and they need to calm down and they need to sleep better and help their blood pressure. And we opened up Modexus in Ireland, Scotland, Ireland area, and all of a sudden, that one product, Tranquility, is being recognized as something that really is helpful to their physical health, and they've gone crazy over Tranquility.
Yeah. Wonderful. Okay, so this is I had actually a gal ask me about this. She said that she's been using the longevity and the lift for about a month, and recently decided to increase her dosage to 4 longevity a day to see if she could possibly get some relief from a sciatic nerve issue caused by lumbar spinal stenosis. After just 1 week on the increased dose, she has felt periodic relief already to the nerve discomfort in her foot and calf. From the science standpoint, what is it that's causing this improvement?
Way to go. And by the way, the sciatic nerve is the longest nerve in the human body, right there at the base of the spine and all the way down to the leg. I mean, it goes way on down the leg. And when it burns and when it aches, it doesn't let up. It's like chronic. But now she said she's going by 2 in the morning, 2 in the afternoon. And as we mentioned earlier, antioxidant, anti-inflammatory. So we got a double working in her system, pulling out the radical oxidants and reducing inflammation drastically. But what is it in Lonicera longevity that is so good for nerve pain? See, the myelin sheath of the nerve is very protective. Not many things can cross it, not many things can penetrate it. But glutathione is the #1 molecule that is allowed into all the cell structures of the human body, including the nerve cells. And that glutathione in our product is a double form. It's got the base unit, the building blocks, and a preformed glutathione to catalytically enhance it. And in each 2 capsules, you're getting more than 1,000 milligrams of usable glutathione therapy with each and every dose. That is far above therapeutic levels. But what we found is that glutathione crosses the nerve fiber, and when it does, it cleans the nerve tissue. Beautiful structural cleansing of the nerve cell. And when that nervous system heals, now we're not putting a Band-Aid on the problem. See, we don't give the patient hydrocodone or Tylenol or Advil anymore. Now we're going to the root cause, cleaning it up, reducing the fire, and now the wound healing, the tissue regeneration, the healthier blood flow into that. And that would go not only with sciatic nerve, but people with neuropathy, or people with multiple sclerosis that have major nerve issues. They do exceedingly well on glutathione therapy.
Yeah, wonderful. Very great. Okay, this we get asked quite a bit too. Is there a different dosage or protocol for any of the Lonicera products for children, and are there any age parameters?
Well, we do say do no harm.
Right.
So when I put it together, we were looking at pregnant women. We were looking at pregnant women who have children. And generally, once a child is able to eat and drink on its own, then they're old enough to take good nutrition. It would be based on the size of a child. Think of the therapeutic dosing as being a grown adult, 100 pounds or greater. And on a child, if it's 50 pounds, use half the dose. If we're doing 30 pounds, use 1/4 dose. Fine.
Okay.
The Lift product, you could think of it as every student a better student. I mean, every student a better student.
Yeah.
They're going to be more focused, more concentrated. They're going to be able to remember, retain. All that's beneficial. And why? Because 40% of all the energy of the human body used by the brain, and Lift is a true brain food.
Wonderful. Okay, this is a subject that's very asked a lot, I'm sure. Diabetes and blood sugar are significant health issues. What is your recommendation on addressing these?
Just before we began, the three of us, Deborah and myself, we were all discussing a person who has posted on the Modexis backboard how wonderful their diabetes has been controlled simply by this Modexis nutrition quality. And insulin resistance is a major problem. That's where the insulin wants to open up the cell and let the sugar go in and produce energy. But whenever the body becomes sluggish, insulin becomes a fat storage hormone instead of burning up sugar for energy. So insulin resistance is a major thing. That's hopefully one of my next inventions for Modexis is correcting insulin resistance, which will correct problems with weight loss and all of that. But Lonicera longevity definitely has the mineral qualities. The Centramin has the chromium and the boron, the manganese, the things that pancreas use to utilize insulin better. And you can literally, with Lonicera longevity, curtail sweet cravings and stop the shakings. You know, when people get hypoglycemic, their blood sugar goes too low, then they get the shakes. And it's all in relationship to that insulin resistance. If somebody feels irritable because they miss a meal, that's usually an indication that we're dealing with blood sugar issues. At the time, we're hypoglycemic, too low blood sugar, but really anybody who is hypoglycemic is going to be diabetic very soon. And we measure the A1C to find out that when people who have heart palpitations after eating sweets, that's usually an indicator that we're on a sugar roller coaster. If people are impatient or moody or nervous or have great difficulty losing weight and they are overweight, or they go to the doctor and they're high in cholesterol, high in triglyceride, high in blood pressure, all of that is part of the syndrome X, part of the insulin resistance. Technically, a man can measure his waist if he's 40 inches or beyond. He's moved into the diabetic insulin resistance. For women, usually the waist measurement is 30 inches. If we drew the blood, we could look at elevated, what they call C-reactive protein. We got ways to measure things like that. But the good news is Lonocera longevity. It goes and helps insulin resistance. It lowers reactive protein. It takes down the triglyceride. It works effectively against bad cholesterol. And the reason, because we're making insulin more sensitive. It's all in the nutritional protocol. And longevity is unique in that it works molecularly in the small cell structures. And when things begin to decrease with aging, the glutathione makes you a whole lot younger. Did you know that in Japan, as of this week, they did a survey that in Japan, one person in every 1,500 people in Japan are over 100 years of age.
Wow.
You know what the unique absolute of all those centurions are? They are all high in glutathione. That ought to tell us something there. And how is that? Ion reduces inflammation, is the perfect antioxidant. And anytime you can improve all your cells to be healthier, you're going to be healthier. So Lonocera longevity can make 10 years younger, light years smarter.
Yeah. Wonderful. Okay, so actually the last one that we've got, and then maybe we'll see if anybody's got a few little quick questions at the end, is because we've been approached by this a couple times too, is what would you suggest to those suffering from migraines?
I got you. Did you know that 43 years ago, I had a migraine headache, and I didn't want to go any further with pharmaceuticals. I didn't want any Zomig or Advil or anything like that. And so that's when I did the research. And I found that the OPC is a molecule that's found in fruit. And guess what? The Lonocera berry and the maqui berry that we get from Patagonia, Chile, both are rich in OPC. And that is the #1 nutrition for migraine headaches. So yes, it is in the Lonocera longevity, and it comes to us from the Lonocera berry and the maqui berry. And then we found that you need magnesium. Where are we going to get magnesium, Dr. Charlie? From Centramin. And Centramin is our molecular mineral complex, and it's got the perfect balance of magnesium. So when you take 2 per day, you're going to be very preventing. Or somebody was in procedure having a migraine headache, I could give them 2 to 4 capsules of the Lonocera longevity and usually subside it within 10 to 15 minutes.
Really? Wow. Wow. Well, this has been fantastic. And I'm actually thinking that we have, about 10 or 15 minutes, Dr. Charlie, if you have time, if maybe, since our group isn't gigantic, that if anybody, we can kind of go around if anybody has a particular question. Does that sound good to you? Okay. Well, why don't I start, Barb, with you? Do you have a question for, let's see, I'll ask, you can unmute. I had you guys all on mute. And if you don't, it's okay. I just thought that I would just go around. Yeah.
Well, most of this group knows my daughter's having major problems, stenosis in her spine. She's back in ER. She was in the hospital last week. She's in ER right now, and they found the MRI today versus last week. She now has a bulging disc in C7. And she's been on the product for about 4 months, both longevity and lift. And, you know, they've tried, you know, everything as far as muscle relaxers. Morphine didn't even touch it today in the ER. So I'm just open to anything. They want her to see a spine specialist tomorrow.
And I'm actually working on some nutritionals for chronic back pain, etc., coming soon. And what you can do, you can text me and give me your address, and I will send you some free samples. You can try what I'm already.
Oh my gosh, you're gonna make me cry.
Yeah. And write this down. Anybody with spine issues and major problems in the back, stenosis, they need to get a nutritional product called BCAA. BCAA, that stands for branch chained amino acid. BCAA. Now, what a BCAA is, it's just 4 amino acids, but they are what we would call the amino acids of mass construction. They actually physically go in there and knit things back together and make the body construct itself better and better. A lot of people right now are taking collagen, which is 20 amino acids. But out of BCAA, it's more concentrated, and they're going to use 4 of the 20 amino acids, and they can get it in powder or capsule. The label will tell you the dose. It's very inexpensive and major benefits. But definitely text me with your address, and I'll send you my new product for back pain.
Yeah. Thank you, Dr. Charlie. I surely appreciate that.
Wonderful. Oh, great. Okay, Patty, do you have any questions for Dr. Charlie? Oh, you might have to unmute, hon.
Yep. I can't think of any right now. I'm sure something will pop up. I was very interested in all of the information he gave us on the gut health. So yeah. I, of course, will be pinging Deb over there. Talking to her about that.
Good. Wonderful. Okay. Patty Knopf, what about you?
My brother is a double organ transplant, heart and kidney, and I just wonder if anything, should not be taken with all his medications. He's on probably 18 different things, and now he had a knee replacement taken out and waiting to be able to get one in. So he's just a mess, and I just want to do whatever I can to help him.
Okay, repeat that, Deborah or whoever.
Okay. Okay. Patty's brother, he's a double organ transplant. He's had heart transplant and a kidney, and he had a knee replacement that then was removed. And so he's just in kind of a poor way right now. And Patty wants to he's on like about 18 different medications. And I know Patty had asked me, is anything going to interact with that? Will any of the Lonacera products interact with medications? And I said, Dr. Charlie won't even ask you what you're on. He says they're not going to interact with anything. But that's what her question was, I think, right, Patty, that you wanted to know what else maybe might help.
Yeah, a plethora of, and when people are on organ transplant medications, many of their things are trying to suppress the immune system. But the good thing about the glutathione that we're using in that product is that while the organ transplant medication is still productively keeping the body from attacking itself, so does glutathione, it's like it's going to keep our patient from getting cancer or from being pneumonia or getting a bad case of the flu and then having a secondary infection. So it's a good idea. Think of Lonacera longevity as just eating the perfect food. It's not a drug. It is not a chemistry of interaction. It's just going to make every cell healthier and more productive.
They want to also put him on an antibiotic for the rest of his life because he had a infection in the knee. They had to take it out. So he had the surgery on July 9th, and they're still waiting to make sure that he can have a new knee replaced. So he just, does not want to go through this again. And I don't know, being on an antibiotic for the rest of your life, I don't know how that can really be safe.
I know it. And the Lonacera is going to modulate his immune system so things don't go down. But we also don't want his immune system to go too hyper up.
Mm-hmm.
Okay, thank you.
Yeah, great. Okay, Lisa, do you have any questions for Dr. Charlie? Lisa Albertson? You might have to unmute, hon.
Hi, Dr. Charlie. Thanks so much. My 23-year-old has been having good results with the Tranquility for her anxiety. And she also, I believe, has the gut issues, and she's always had constipation issues. So I want to start her on everything, but she's been taking the Tranquility throughout the day. I think you had said because she could take up till 4. So we've been doing that throughout the day. Is adding in the longevity and the lift going to counteract the Tranquility calming effect?
Not at all. They're going to be synergistically working together, and they'll actually improve the peristaltic movement, which means less chance of constipation, better bowel movement, all of that good stuff. So it should all work together.
So she was doing 4 of the Tranquility, spacing them out as she needed them. Another case of where we ran low, and she really could tell the difference when she didn't have them. So just like maybe 1 longevity and 1 lift in the morning first, and then see add the Tranquility in.
One, and let's see how it goes.
Okay.
Perfect. Great. Thanks, Lisa. Okay, Mary, how about you? Do you have a question?
I do not, but I do want to say thank you because I've been on both the longevity and the lift for 4 or 5 months now, and it's heavenly.
Yes.
Thank you.
Good, great. Well, I have just a little something to share. It was really cute. My stepbrother and his wife, they've been on the products just a month, and they can already, they felt great. Debbie had a little bit of gastro, was going to the bathroom a lot at first, but she has a real sensitive digestive system, but she went back to 1 pill, only took like a couple days. She goes, everything's good. But what was interesting is when I asked them, they actually came right out and said it. She said, you know what, we're feeling, I don't know, we can't really say it's more energy, but both Kirk and I feel much more motivated. They can really feel being on the lift that they have more motivation. And I said, well, Dr. Charlie calls it, he turns on your motivation molecule.
Yeah, if you go do research on TEACRIN, TEACRINE, it first came to the market to sustain energy, but everybody in the athletic arena said, "Woo, this is my nutrition because I'm motivated to go the extra mile," and motivation is really good.
Yeah. It's been great. So I think you might have remembered my story about my hand, Dr. Charlie, that I had, I was going to need carpal tunnel surgery. And it's like now I'm not even wearing the brace anymore. I went to see the hand surgeon just because I had the appointment and told him, this is the only thing I've done. And he said, that's just incredible. It's fantastic. So it's just such a testimonial for me to not think about having to go and have surgery. And then I don't have any pain. It's fantastic.
Amen.
Yes, yes. Okay, Deb, what about you?
You know, I just want to share, you know, one of the things I absolutely love about the lift for me is that I exercise 7 days a week now. And I have found that it makes a tremendous difference in my workouts. I mean, like I'm stronger, I can run longer, I can lift heavier, I have no pain, and I have it's a really speedy recovery right into the next day. So that has been something that's been huge for me. And I've shared it with other people that have the same issues, you know, and it's hard to get, you know, working out every day of the week. And it makes a massive difference. So I think that anyone, you know, that, you know, exercises regular, that's something that they could really probably use besides all the other benefits of the lift that are so many.
Right,
So
right.
thank you.
Well, this has been wonderful, Dr. Charlie. This has just been such a treat. And I think that you've given us just, I love the word plethora of information. And we look forward again sometime in the future, maybe after there's another new product out there, that we can have you again sometime too. And I think, thank you for being so generous to Barb and having her, I'll give her your number. And so she'll text you with her address, because I know anything that we can do to help Krista. I mean, she's just, this has been really hard for Barb. So that'd be great. Great.
Thank you so much, Dr. Charlie.
Okay, Dr. Charlie. Okay, everybody. Well, have a wonderful rest of your week, everyone. And just loved this. And we'll see you all the next time.
Thank you.
Okay.
Thank you for sharing.
Okay, thanks again, Dr. Charlie. Okay, bye, everyone.
Bye-bye.